My son just got his braces off. He's several years younger. A year and a half ago, I would have loved a dentist to open on Sunday and at nights. The hours were really confining.
Absolutely. I mean, people are coming on weekend to us. They very appreciating that we are open. But unfortunately, they don't know. Uh, they find out when they have the pain. So
Yeah.
they started to research, go online, find who is open on weekends. We have patients coming from Rhode Island, from Massachusetts, White Plains, New York. I just have it last Sunday because they have pain.
Yeah. I mean, are you popular in the dental community? Because I would imagine other dentists are like, oh, there's that guy that's open on Sundays.
Correct, and I get, yeah, of course.
For real?
Yeah, I get referral even from the other doctors. They send it to me because their office is not open. You know, dentistry is not like a law firm. You need to have the dental assistant. You have to have auxiliary to help you. It's not like
Sure.
a dentist can go and perform root canal by himself without having no assistance. So it takes a lot of resources to do the procedure. For that reason, if the dentist is open, it's open. But when they are not open, they cannot even go back to their office and perform the procedure in the full scope because it's impossible to do that.
Now you said nighttime hours too. Until what time at night?
7 a.m. we open, we close at 9 p.m.
9 p.m.
9 p.m. Sometimes, patient come and it, things takes longer. Sometimes we close at 10, 11 o'clock. We get the job done.
Yeah,
And
people
bottom line,
absolutely.
we don't let anybody go home without pain or without the tooth. Because it's not just the pain, many people they come because they lost their front teeth or their front teeth need to be removed. So we give them at least some type of provisional tooth or prosthesis to go home with it.
Yeah. Now you had mentioned too about as far as banks are concerned, this is concerned, that you must have payment plans just between you and your patients.
Sure, we do have a third-party company. We work with few of them, Care Credit, Cherries, so they can finance the treatment plan for the patient. Unfortunately, there is a misconception about dental insurance. Unfortunately, dental insurance, in many aspects, they don't work like a medical insurances. They give you just certain amount of the money every year and it doesn't roll over to the next year. For that reason, those financing, it comes handy. Basically, dental insurance is more like let's say, like a dental coupon rather than real dental insurance.
Yeah, and there's some splitting hairs too. Cosmetic versus this is necessary. This hurts.
And of course, we get a lot of denial from dental insurance. So at the end of the day, dental insurance is a help, but unfortunately, to my experience, as most of the time, is not a tool to cover the whole procedure.
You had also mentioned you wanted to discuss ideology and ideological differences. How could there be ideological differences between dentists? What's the difference?
Okay, I would say not between the dentists, but ideological differences between many of bigger dental entities, other companies with us. And the difference is, let me put it in the very historical context. I started Columbia Dental as a true operatory practice, and I opened it. I was working in another dental office, and then offered to the other doctor to work at night, and the other doctor says that is too much. I cannot, accommodate you for dental assistant, staffing, and so on. So for the fun, I started to open very small dental practice in 700 square feet in Manchester, Connecticut, and I saw patients at night.
Yeah.
And
Hence the moonlighting.
and moonlighting, and the model works very well.
I would imagine.
And within 6 weeks, I had to quit my job. And over years, I keep adding doctor. I expanded, opened different locations because the model worked. The difference is most of the business start by having a business plan. So you go write your business planning, submit it to the bank, you get the loan, and start from there. So the bank start, or financing company, they start from the beginning. I didn't do that way. I did it organically. That means when the fund was available, I expand open. When there is no fund, I hold on the expansion. So as a today date, my company does not have any loan obligation and does not have no investor. So if our banks and investors, they are not our bosses. We are only responsible to answer to our customer and to our patients. So that it make it different with many other bigger company that you see a lot of corporate, involvement
Sure.
and greed in the process. We don't. Columbia Dental does not have that one. So for that reason, we grew up organically, and we are operating organically.
How big is the staff now? You're celebrating your 25th anniversary. Come
Yeah, we have more right now than more than 200 staff, and we have 13 locations through state of Connecticut. Basically, we are from we start from on 95. We have location from Norwalk to Enfield, and we have location on the 84 part of it. We have from New Milford up to Manchester, Connecticut.
Get the state covered. I'm about to ask you a question. I don't want everyone in here to think I'm crazy. And maybe I am, and just tell me if I am. But really, I would sincerely love your take on coconut pulling oil.
Coconut, okay, tell me about it.
Yeah.
Okay.
Yeah, because it was advised to me
Uh-huh.
a year ago for a variety of problems I'm enduring as a man in his 50s, and it's not doing anything for me.
It doesn't do anything.
It's not really. I cannot say that it is.
The coconut oil you said, I don't know, as a dentist, I know that oils that are not driven from animal are more beneficial than
You're aware it's a trend,
Yes.
coconut pulling oil right now.
Yeah, but I don't know any beneficial specifically on the oral health, not top of my head.
Yeah, because you do, and again, we're with Dr. Mohammadi from Columbia Dental. It's columbiadental.com. Is there a lot of your patients, your client base, people my age, right, older?
Well, you are not older, but go ahead.
Am I not? But this, all right, that's great.
Okay, because if you make yourself older, then you make me dead. So.
Well, I've got it all. I've got overcrowding. I've got sensitivity. I've got one tooth is just absolutely driving me crazy. And there's all these different places, your social media feeds, these ads that pop up.
Okay.
Coconut pulling oil, and you rinse with this. Get up to the point where you're rinsing 10 minutes a day, twice a day. Takes care of all of it. Does not.
Honest with you, I haven't seen any scientific article or anything on the coconut.
What would you
oil.
recommend for such a thing? I tried the mouth guard. The mouth guard did not do much for me, which is why I don't believe actually I'm grinding. I believe my teeth are just overcrowding, and maybe I'm narrowing as I get older. What is your take?
So
I gotta sit in your chair, Doc.
Okay, my take is that those social media,
I know.
I would say it is really is not scientific, and the reason is that we believe in a customized treatment. So what I can be good for you, it not be good for somebody else.
Right.
So every individual we recommend to come to the office and have a comprehensive exam. That means taking radiograph and make a proper diagnosis by the dentist and the professional. Because some of your sensitivity, it might be too many reasons. You might have a cavity, you might have a gum recession. There are so many reasons. So what might work for you, it might not work for the other person. So for example, if you have a gum recession, there are certain toothpaste or there are certain prescription toothpaste like Sensodyne or Prevedent that we can prescribe it. Sometimes we do it. And also that depends on the severity of the sensitivity, if those medication is going to work or not. But let's say if you have cavity or decay between your teeth, if that's the cause or the etiology of having a sensitivity, I can prescribe you, Sensodyne or many other. Is not going to work. Or you might think, oh, coconut oil will work, or you rinse all day along with coconut oil, and still you don't get the result.
Yeah.
So we believe that to go through the social media and try to extrapolate something that it
Sure.
works for some individual to the whole population without having the proper diagnosis is not the right way to do it. So for that reason, we recommend patients to come to the office,
Of
to
course.
the dentist,
I know,
and to
put
be
me on the spot.
evaluated properly rather than,
Yeah, I want you to know that the coconut pulling, I mean, it was an act of desperation because my last couple of visits, I was making these complaints, and I'm 57 years old, and they're like, you have to have braces. Nobody wants to hear they have to get braces at 57. What's the oldest you've ever said to to rectify this issue?
Well, I had patient on late 70 that
Really? Get braces?
We did the braces. We had patients at age 88 that we placed dental implants. So basically there are two,
88?
at these days.
My man's still going to the clubs or something at 88.
You see, the concept has been changed, chronological age and biological age. So it doesn't matter what's the number you have, it's how healthy you are and what condition you are. So as long as you're healthy, you can receive any dental treatment at any age you wanted to do.
And your mouth health is the gateway to
Absolutely.
you know,
Absolutely.
I have one sister who's always hammering me with that.
Absolutely,
Like,
it's
that's the
a
gateway.
part of the body and affect the other part of it. Its recent study shows that gum disease and periodontal disease can lead to the cardiovascular disease, heart attack. So it makes sense. Bacteria, they can travel from one part of the body to the other part of the body.
When you mentioned Sensodyne and toothpaste like that, and we can prescribe that, I see them. For say, I use that even. Why would you need to prescribe what's sold right there on the counter?
Okay.
Or are there versions of them that are no? You need a prescription for them.
Good question. Okay. It has to do with the concentration of fluoride, basically. So fluoride, and I know these days is a part of a lot of conversation. Fluoride. One of the effect of the fluoride it has some type of anti-sensitivity effect on the teeth. So the one that you see on the Sensodyne, the concentration is lower. The prescription, it means that is a higher prescription, so the patient, they cannot go and grab it from the counter in Walgreens and use it excessively. Because higher concentration of the fluoride obviously can be deleterious to the health. Same thing like for pain medication or analgesic. Of course, if you want to have a pain, you can go grab it, from, ibuprofen or Advil
Sure.
from Walgreens. But if your pain is more intense, then and you need something stronger, you need prescription, because we don't
That's
want
great.
a patient to use it or abuse it or use it on their own discretion.
Yeah.
So that's why those toothpaste being regulated by prescription, so the patient they not overuse it.
Yeah, I'm so glad I asked the question too, because it's a day and age of Google, WebMD, and we try to solve our own health issues online, but really got to sit in the chair. You have to get the exam.
Correct. And even just let you know, even let's say radiograph are not all diagnostic. There are sometimes decay cavities that are not detected radiographically, and then we need to do clinical examination. So even let's say, I don't know how that WebMD works, but even you transmitted the digital X-ray to a dentist, let's say sitting in Missouri on his computer desk, still he cannot make the proper diagnosis by just watching those radiographs. So on the proper diagnosis, it can happen only in conjunction with the, of course, radiographic evaluation and clinical examination.
And I mean, the smile has perhaps never been more important than it is. We're a nation of, we're taking selfies all the time, telling people delete that, that's an awful angle, so you're probably seeing more people than ever before.
Correct.
Yeah.
Correct.
Well, I've loved meeting you. I hope to get in that chair. Which location would be closest to me? I'm on the shoreline.
Where do you live?
I'm on the shoreline. I'm in Branford.
Shoreline.
Yeah,
Okay.
so I'm down New Haven way.
Okay, we do have location in New Haven,
I'm happy with that.
and we have location in New London, so or Manchester. If you want to come after your work,
Yeah.
you can just, it's 10-15 minutes driving to Manchester.
Fantastic, Dr.
Yeah.
Mohammadi. I appreciate you coming on. It's Columbia Dental, columbiadental.com. Anything else you want to make sure you get out there?
No, I think we covered everything.
Yeah. Very organic.
All
It
right.
flowed.
Okay.
It was very organic.
All right.